everyone. Today we are going to discuss about some of the ICU medications, some of the inotropic medications and vasopressor medications commonly used in the ICU. Also, we will discuss about what is the difference between inotropes and vasopressors. In the coming sessions, we will discuss about what are the common medications which is using in ICU and what is the mechanism of action and how to titrate the medications. What is inotropic medications? How it affect? What is the mechanism of action? That means in inotropic medications, it increases the strength of the heart muscles by increasing the contractility of heart muscles. So when there is increased contractility happens, so what will happen? It automatically increases the cardiac output, and also when there is increased cardiac output, what will happen? It increases the organ perfusion. Isn't it? Okay. Now what are the common medications usually using in ICU? Epinephrine, dopamine, dobutamine are the commonly used, some of the commonly used inotropic medications in the ICU. So hope everybody understood what is the mechanism of action of inotropic medications. Coming to the vasopressors, vasopressors are medications that constrict the blood vessels. Here it will not act on the heart muscles. It constrict the blood vessels. It constrict the blood vessels. So when there is constriction happen to the blood vessels, what will happen? It automatically increases the blood pressure. Right? See, here in inotropes, what is happening? Here also there is contractility of the heart muscle. So it increases the pumping action of the heart. So automatically what will happen? There is increase in, along with increase in cardiac output, there is increase in blood pressure. So BP will increase in this case. Also, vasopressors, there is only blood vessel constriction happens over here. So when there is a constriction of blood vessel, there is increase blood pressure. By increasing the vascular resistance, the vessel's resistance increases. Due to that, there is more pumping will happen and blood pressure will go high. Inotropic medications usually using when there is heart failure, when there is heart failure patients are there in ICU, we are using inotropic medications. Vasopressors usually using when there is a low BP for shock patients, usually using in ICU. So what are the inotropic medications? Commonly used one, I'll just explain. The epinephrine, dopamine, dobutamine. Some of the examples for the inotropic medications. Here comes the vasopressor medications. Vasopressin, dopamine. Dopamine also positive inotrope, also it's a vasopressor. Dobutamine also same. Noradrenaline, phenylephrine, these are some of the vasopressor medications which is commonly using in ICU. So, vasopressors act on the blood vessel to increase the pressure, while inotropes act on the heart muscle to improve its pumping efficiency. So, automatically both will increase the blood pressure of the patient. Hope everybody understood what is the difference between inotropes and vasopressors and some of the medications which is commonly using in ICU. In the next sessions, we will see details about the medications, mechanism of action and how to titrate these medications. Thank you for watching.